Hello, everyone. My name is Nicky Stanley. I'm a professor of social work at the University of Central Lancashire, which is in the northwest of England. And I'm co-director of the Connect Centre for International Research on Interpersonal Violence and Harm. I've been asked to talk to you about strengthening the professional response to children living with domestic violence and abuse and stalking. And my starting point is this image, which the project has put together. I think it's a very helpful image. It shows the child in the center of a maze. This is the child who has experienced stalking or domestic violence and abuse. And the maze represents the routes to various professionals who should be able to offer support and work to end the violence and abuse or stalking, whatever the child is experiencing. But the child finds his or her way blocked through the maze. They can't reach those practitioners and get them to respond in the way they'd like. And the child is saying, why don't they do anything? Why do they let this go on? And one of the things we need to recognize is that when professionals appear ineffective or impotent to a child, it really magnifies the power of the perpetrator. When the outside world, when figures of authority can't intervene and make things better, the perpetrator becomes especially powerful in the child's eyes. And that is a consequence of professional inaction or impotence. So we have to really acknowledge the importance of an effective professional response and think about how we make that happen. I'm going to look at this issue by talking about three professional groups. I'm going to talk about the police, I'm going to talk about teachers and schools, and I'm going to talk about family doctors, because these are all frontline professionals who are most likely to come across children's experiences of domestic violence and abuse or stalking in the first instance. So, turning to the police, what do children want from the police? Well, actually, there is quite a lot of research evidence now telling us what children want from the police. They want the police to talk to them about domestic violence and abuse and stalking. They want to be kept informed. They want to know what's going to happen next, and they want to be taken seriously. And these quotes are from children who participated in a study colleagues and I did back in 2012. Here's Dawn saying, when my dad came round and he started kicking off, that means causing trouble, the police came round and they arrested him. They took a statement from my mum and that's it. They didn't say to us what happened, if he was going to be released the next day. We didn't find out anything. And here's Nicola saying, they listen to the adults more. They don't want to talk to you, talking about the position of children and young people. And Louis says, when the police come straight away, they could take him straight away instead of waiting around and everything and listening to sides, listening to the different stories. They should be taken away because a mum or child wouldn't call 999, that's our emergency helpline, just to get a dad taken away for no reason. So when Louis asks for help, he wants to be taken seriously. And we know quite a bit about what police practice with children at incidents of domestic violence and abuse looks like. There's really very little evidence of police engaging directly with children. Half the officers we interviewed for this study expressed some reluctance about talking directly to children, and no information was provided for them. And when we interviewed officers, they acknowledged this. Here's a frontline officer saying, talking to children, it's not something that's done as often as you would probably think. And here's a supervising officer saying, I would probably have to say that they, that's the police, don't talk to children, probably because they wouldn't know how to. I'd actually take issue with that because I think police know perfectly well how to talk to children if they think children are breaking the law or behaving badly. But in situations of domestic violence and abuse, somehow they don't see the child. And there are consequences for the police's communication with other services that arise from this lack of engagement with children. And our study actually looked at the interface between the police and social work services, and we found that the quality and accuracy of information that was sent through to social workers really varied regarding children's names, their addresses, their ages, and that made for difficulties on the side of children's social work in identifying those children in their records. The police did report all incidents where children were injured to children's social work, but the full extent of children's involvement in incidents wasn't always communicated. Information was sometimes incomplete, and the social workers we interviewed who were receiving this information described a lack of detail concerning children's involvement in incidents in the information they received from the police. So if we turn to teachers and schools, what are their responses to children who live with domestic violence and abuse and stalking? Schools are really important places for children. It's where they spend a very large proportion of their time. It's where they have the opportunity to feel safe, to feel secure. There are real opportunities in the school setting for children to build resilience to domestic violence and abuse. School staff can play a key role in monitoring parental stalking, both near schools and online. Schools are also non-stigmatized settings for delivering support, but teachers themselves may lack confidence and expertise in stalking or domestic abuse. So it's really important that schools have strong links with local domestic violence and abuse services, so that they can refer children there and ask for advice and help in how they should be working with children. Confidentiality is really important. Reports in the UK suggest that actually teachers might be excluded from information sharing with other agencies. They get left out of the loop, but they themselves may not share information due to concerns about confidentiality. And confidentiality is also really important to children. If services or support are delivered to children in school, they need to be hidden from peers' gaze. And here's an example of where this was successfully done. This is Finn, who participated in the study some colleagues of mine did in 2021. And he's talking about receiving a support service for children who've experienced domestic abuse in school. And he says, I saw them in a room at school where no one else could see us. And the researcher says, and did your classmates know who you were talking to? And Finn says, no, I kept that private. And the researcher says, how did you manage to do that? Did they ask you where they were? And Finn said, they did ask me where I'd been, but I just said I was doing jobs for teachers and found other excuses. So this confidentiality and assurance that peers won't be able to see what's going on is really important to children. So I want to tell you a bit about Operation Encompass. This is a national scheme in England and Wales that aims to improve communication and collaboration between police and schools. And police notify schools when they've attended a domestic violence and abuse incident where a child is present before the start of the next school day. So it's a very rapid form of communication. The scheme provides online training for both police and school staff. So far in the UK, we've only had local evaluations of this scheme, but it does have the potential to improve the sensitivity of both police and schools. One shortcoming is that it is very focused on incidents that the police attend. So it may not encompass the experience of coercive control or stalking. And Nicky Stanley and colleagues have written a very useful article about that. I'll give you the reference at the end, which draws attention to the parallels between coercive control and children's experience of stalking, and points out how these differ from incidents. So you can find more information about Operation Encompass at this website. So to move to family doctors' practice with children who are experiencing domestic violence and abuse, I want to talk about a study I did with colleagues at the University of Bristol in 2015, where we interviewed doctors and talked to them about whether they would speak directly with children experiencing domestic violence and abuse. Only 5 of the 54 doctors and practice nurses we talked to had or would talk directly to children about domestic abuse. And here's one doctor saying, it would be a very good thing to speak to children about it. I'm not sure I would do that, actually. And another one who said, I must admit, if they're at school or a teenager or something like that, no, I don't. I've never made arrangements to do that. You mean talk to them, examine them, or what? It was clearly a very alien idea to these doctors that they would talk directly to children about domestic violence and abuse. In the small number of practitioners who said they had done so, this one doctor said, sometimes you have to, because they've already decided they don't trust those grown-ups, then you have to be the one who tells them stuff. But these doctors were in the minority. And as with the police, doctors described their communication and collaboration with social workers and specialist domestic violence and abuse workers as non-existent or problematic. Here's a practice nurse saying, I think what we miss out on is knowing who the social workers are, what makes them tick, what sort of work they can be doing with these families. This practice nurse really doesn't understand how social workers would work with families living with domestic violence and abuse. And another practice nurse who says, I haven't had any feedback from the social worker. It would be nice to know what's happening. So she's made a referral and wants to know what happened next. And here's a doctor saying, in respect of domestic abuse services, I don't know what services are available, to be honest, in this area. I'd have to go and find out. Yes, he would have to go and find out, wouldn't he? So what these doctors we interviewed described was what we call the can of worms syndrome. I don't know if this phrase is familiar to you, but we talk about a can of worms when you open a can and what's in there is very messy and overwhelming. And here's a doctor who participated in our study who described this very well in relation to working with children who've experienced domestic violence and abuse. And this doctor said, if you don't know what you're going to do about something, if you find out about it, then you don't make any effort to find out about it. The last thing you want to do is get someone to disclose domestic violence and then have no idea what you're going to do about it. So it's really important, if we want these practitioners to engage with children experiencing domestic violence and abuse and stalking, that they know where to refer them, that they know what the next step is, that they know where they can get expert help, because these sorts of frontline practitioners won't necessarily be delivering support and interventions themselves. They're going to be looking to other services, to social work or to specialist domestic violence and abuse services to do that. There are also barriers for families themselves in talking to doctors, and we built on this earlier study in a more recent study. These quotes come from a paper by Roy and colleagues, where families express their concerns about confidentiality and safety, especially if the father, the perpetrator, is using the same doctor. And here's a GP saying, people will say, what matters to me most is not having someone thinking about taking my children away. We know, don't we, that mothers in particular really worry about discussion or disclosure of domestic abuse or stalking leading to them losing their children. And it's really important that they're reassured about that. And here's a mother who said, it will be really, really bad if he knows that I'm here receiving help or that my kids are receiving this kind of support. So the reassurance around confidentiality and safety is really important for families as well. So in terms of how we improve the responsiveness of family doctors, The study I'm talking about was called the IRIS Plus feasibility study, and it actually introduced some particular interventions which were aimed at helping family doctors engage more fully with children and mothers experiencing domestic violence and abuse. First of all, family doctors and other clinicians received specialist training in domestic violence and abuse. And secondly, a referral pathway was established for doctors to refer their children and mothers who were affected by domestic violence and abuse to a specialist service. And this specialist service was established to work with those families. So this intervention was evaluated and the findings were mixed. So 49 children in 4 practices were identified in health records as having experienced domestic violence and abuse. And these children had been notified to family doctors by the police in the main. But only 4 of these 49, and the police had been told about them, were referred to specialist services by doctors. Another 35 children were referred to the specialist service by doctors following mothers' spontaneous disclosures about domestic violence and abuse. And 22 children received support indirectly through their mother, and 6 received support directly. So one of the conclusions was that concerns about children's vulnerability and limited capacity to actually talk about domestic abuse with practitioners persist among family doctors, and training needs to address doctors' conceptions of children's rights and status. So to summarize on what we know about how the professional response to children living with stalking and domestic violence and abuse can be strengthened. Firstly, practitioners need to see the child and acknowledge them as rights bearers. And this is a very useful point made in Miller and colleagues' review that came out recently. I'm going to give you all these references at the end. Legislation can assist in this respect. We've just had legislation introduced in England and Wales, which identifies children in their own right as victims of domestic abuse. And that is really going to improve the professional focus on children and young people. Relevant training is training that addresses the impact of domestic violence and abuse and stalking for children, avoids focusing solely on incidents, and promotes understanding of other services, roles and culture, because this work is going to be interprofessional. Practitioners need to understand not just what other services do, but why they work with children in this way. And this is described as institutional empathy. Clear referral pathways and good links to local domestic violence and abuse or stalking specialist services are really important. And one way of creating these links is to use your local specialist organisations to deliver the training. This is what they did in the IRIS Plus scheme. Providing feedback to referrers also looks as though it would be a helpful strategy. Practitioners' concerns about confidentiality need to be addressed. This is a really big issue. One way we've addressed this in the UK is we've set up these sealed information hubs where information about families experiencing domestic violence and abuse can be safely exchanged, and files can be shared between different organisations. Another way to go about this is to integrate all the services in one organisation, but that does need to be tackled. And children and families themselves need reassurance about confidentiality and need to be able to disclose their experiences and receive help in places that they feel are safe and away from the scrutiny of others. So thank you very much. Here's the references I've talked about. I do hope that you'll take the chance to read a bit more about this and find out more. There is now quite a lot of really useful evidence out there. Thank you.